Does alcohol actually harm the teeth?
Alcohol will create in the long run some changes, biological changes in your oral structure and lead to any disease.
Give me three things uh, which affect the teeth in the negative way.
See, one will be not only alcohol, in general you can categorize aerated drinks.
Okay.
Carbonated aerated drinks because they are pure acid which you are drinking. Secondly is definitely tobacco.
Whether it's chewing tobacco or smoking, like even hookah is very bad.
When did you decide that you would not want to maybe work with somebody else or at a maybe hospital or something, but in this business? ये कैसे
Very
decide
good
किया?
question, very good question. So during my like college time, I realized कि अरे यार मुझे तो सिर्फ patient करने थे, but in dentistry, opening up a clinic is a big like there's a lot of aspects to it.
Right.
तो हम तो सिर्फ patient करेंगे and doctor भी क्यों बनेंगे? I want to spread love and light in this world.
Right.
That's how I got into dentistry, not for like earning money, yup, as a profession, नहीं, as a passion to serve people.
And who gets paid more, the Indian dentists or the dentists who are outside India? Hi, Dr. Prabhjeet. Hi, Dr. Harleen.
Hi, good morning.
Hello.
We are sitting in a very auspicious day today. At least we are shooting on a very auspicious day. Today is Mahalaya. It's one of the very important and auspicious day in Bengal for Bengalis and for other communities. I think this will be releasing somewhere around December. But the fact that we are shooting in such a beautiful day. So what do you think? Is it God's will that it has brought us together on this day, or is it just pure coincidence? Why don't you go? Because it should always start
Ladies
with
first.
ladies.
You know, as you're saying this, I'm getting goosebumps that, yeah, this was meant to be on this day. And I'm really honored to be here. And especially how it coincided such beautifully with all my team members. And you also said yes to this podcast. So I'm really honored.
It's my pleasure and it is the team's pleasure for sure.
Yeah, see, I've always kept in this mind that whatever happens is according to God's will, and we are just the puppets who do the action, but it's all pre-decided by Him. So yes, it was supposed to happen today, and it is happening.
Okay. So you mentioned God as him. God can be her as well, right? So
Yeah, He can be as her.
है ना, तो हमको नहीं पता वैसे क्या है, आपको क्या लगता है
See,
भगवान
yeah,
लड़का है या लड़की?
I think it's just a divine power,
हाँ.
and it's a belief, and belief has no. I think it should not be personified according to
Absolutely.
anything.
Right. So एक बात बताओ, आप लोगों ने ये डॉन्शिया डेंटल केयर प्रोनाउंस सही किया मैंने?
Yeah, exactly.
ये डॉन्शिया डेंटल केयर आपने कब स्टार्ट किया और कैसे स्टार्ट किया?
So, I finished my dental studies and internship by 2000. And after that, I was very eager to start my own practice because it's said that, when you're learning to drive, unless and until you don't drive on your own and meet the ups and downs, you don't become an expert driver. So as soon as I finished my studies, after a year of practice, I started the clinic. And now the question was what name should be kept. So, and I wanted a name which included everything in dentistry. And as dentistry has around 8 to 9 branches, so every branch ends with the Latin word dontia.
Okay.
It's like orthodontia, periodontia, periodontia, because dontia means related to teeth. So
Okay.
I thought let me keep it Dontia Dental Care.
And how did she come in between? Was it like a love marriage that you guys had and you thought कि चलो business में भी घुसा लेते हैं, या business partner बनी और प्यार हो गया? बट लोग तो कहते हैं कि जहाँ प्यार करे वहाँ, जहाँ व्यापार करे वहाँ कभी ना प्यार करे, तो ये कैसे हो गया?
Would you like to say?
So, प्यार करे, that means what do you think? Guess.
मुझे तो लगता है कि जहाँ प्यार हो वहाँ ज़रूर व्यापार होना चाहिए, बिकॉज वो ट्रस्ट रहता है, वो कॉन्फिडेंस रहता है, वो भरोसा रहता है, वो प्यार रहता है, एंड साथ में मनी मैनेज कर सकते हैं. बट बहुत लोग मानते हैं कि झगड़े होते हैं, अनबन होते हैं, कभी कभी अपनों के बीच में वो पैसे के जब दरार आ जाते हैं तब थोड़ा सा डिफिकल्ट हो जाता है. बट मैं मानता हूँ कि ज़रूर व्यापार प्यार साथ में होना चाहिए.
So that means you have already guessed कि हाँ प्यार पहले हुआ है.
मुझे तो ऐसा ही लगता है.
I don't know. people keep telling me and asking me the same question over and over again, and will you believe or not, I don't know, but ये conventional traditional arranged marriage थी.
अच्छा.
And I was supposed to come back. I have studied in Maharashtra. So in Ganesh festival, I was coming back to my parents' house for a short vacation. My father said, एक लड़का है, you want a dentist to marry, so देख लो. Would you be ready to see? मैंने कहा ठीक है, देख लेते हैं, छुट्टियां चल रही हैं, लड़का देखने में क्या है, एक थोड़ी होता है, 3-4 देखेंगे. तो जब देखा तो लाइक लाइक क्या प्रॉब्लम है, ठीक ही लग रहा है, लड़के तो ऐसे ही होते हैं ना. I didn't know how to say no. I don't have a reason to say no. So yes हो गया. तो my दादी overheard the conversation like when I was asking my friend, यार लड़का तो ठीक ही लग रहा है, अब ना कैसे बोलूं, because I'm not ready to get married. ये तो देखने की बात थी ना. तो she said कि अगर ठीक ही लग रहा है तो देख ले फिर. She also didn't have any reason to say no. And my दादी overheard the conversation and she explained. She just announced it to everybody. हाँ हाँ ये इसको ना तो बोलने समझ नहीं आ रहा है तो हाँ ही समझो. That's how we got into Roka and then marriage after 1 year. I was doing my internship when I got engaged. No, I was in my final year of college when I got engaged, and after marriage, I did my internship, went to Maharashtra. So that
And
was
when
it.
did you decide that you would not want to maybe work with somebody else or at a maybe hospital or something, but in this business? ये कैसे
Very
decide
good
किया?
question. Very good question. So during my like college time, I realized कि यार यार मुझे तो सिर्फ patient करने थे, but in dentistry opening up a clinic is a big like there's a lot of aspects to it.
Right.
तो हम तो सिर्फ patient करेंगे and doctor भी क्यों बनेंगे? I want to spread love and light in this world.
Right.
That's how I got into dentistry, not for like earning money, yep, as a profession नहीं, as a passion to serve people. So यार ये तो I तो just want to do my work and not take care about की lab bills or any other bills, rentals, machines. There are so many aspects to it.
Correct.
तो उनका यार एक ऐसे dentist से शादी करते हैं, like he'll be managing the clinic and I'll be just doing my work of serving my patient.
Right. Okay. So, you both are Punjabis. आप लोग सिख हो. सो अब सिख में क्या होता है, दारू तो बहुत ज़्यादा चलती है, ठीक है. अब स्पेशली एंड सिख ने ये इंट्रोड्यूस भी कर दिया टर्म पटियाला पैग. सब लोग 30-60 में अटके हैं, आप लोग 90 में पहुंच गए हो. सो कूडोज टू दैट. बट एज डेंटिस्ट अक्सर ये माना जाता है कि अल्कोहल शायद दांत का प्रॉपर्टीज़ को थोड़ा सा ख़राब कर देता है या डिस्ट्रॉय कर देता है. तो हाउ डू यू मैनेज बोथ द साइड्स? हाउ डू यू कन्विंस योर सेल्फ नहीं यार दारू भी ज़रूरी है, दांत भी ज़रूरी है, दोनों कैसे मैनेज किया जाए?
तो पहले तो मैं ये बता दूं before you start कि he is a teetotaler.
अरे क्या बात है
अब how
पाजी.
do you manage yourself? नहीं, how do you manage your friends and family?
यस, चलिए क्वेश्चन वैसे घुमा देते हैं.
So see, even when like you heard and you were surprised, I'm a teetotaler. So anyway, in a party when I go and I say I'm teetotaler, they say, I mean, आप फिर सिख कैसे हो?
अब सरदार ही नहीं हुए.
So you just imagine when I passed out from Manipal, okay, and Manipal is renowned for outgoing parties and all that, and everyone who goes there gets used to drink, whether he's drinking it or not. But when I say that I don't drink, hardly anybody believes it. 5 साल आप मणिपाल में रह के नहीं पीते हो, ये विश्वास नहीं होता है. But that's how it is because it's in the family. None of my family members, my father, none of them us drink. And जहाँ तक सरदार पीते हैं बहुत ज्यादा, वो गाना है ना दारू बदनाम, दैट सॉन्ग. सो ऐसे ही है, जो खुले में पीता है वो बदनाम होता है, पर सुमड़ी में एक छुप छुप के पीने वाले
सभी पीते
बहुत
हैं,
है.
सभी पीते हैं. बट आप एक बात बताओ, डज अल्कोहल एक्चुअली हार्म द टीथ?
See, anything which is not supposed to be taken or in nature, whatever food we have which is healthy is always beneficial, and which is not will always affect and create anomaly in your normal oral health,
Right.
or your general health.
Right.
So alcohol in the same way will create in the long run some changes, biological changes in your oral structure and lead to any disease.
Right. If I have to ask you, and any of you all can answer me the question, if I have to ask you, give me 3 things which affect the teeth in the negative way. 3 food items or drink items or anything that affects the teeth in a negative way. What will it be?
See, one will be not only alcohol. In general, you can categorize aerated drinks.
Okay.
Carbonated aerated drinks, because they are pure acid which you're drinking. That is one of them. Secondly, is definitely tobacco.
Hmm.
Definitely. And
Whether it's chewing tobacco or smoking and hookah. People say, yeah, I'm not having pan masala, but like even hookah is very bad.
For
so
For
teeth?
oral, but
for the
overall,
Oral
entire,
health. Overall oral
health,
health.
yeah,
Acha.
overall health and oral health, the
because
mucosa. See, dentists per se, it's not only teeth. It is the inside oral mucosa, how it is affecting the soft tissue around teeth. So Dontia
Right.
is like anything related to teeth, because people think that when they're coming to dentist, you also ask only about teeth. But it's not only about teeth, it is about the gum tissue, which is supporting teeth. It's about the cheek tissue inside, the mucosa inside, which is where like is very sensitive, and it gets hampered by there are kind of thick fibers which get made with the pan masala people have known, the
so
smoking
when
and
you're
all.
having alcohol, tobacco, whatever you're having, the first contact is the oral cavity.
Correct.
Okay, and the more frequency you get addicted to it, more and more contact causes these changes which lead to cancer. Tobacco, alcohol, aerated drinks. Just imagine what happens if you take acid in your mouth. Okay, if you're not taking a strong acid, you're taking a weak acid, but in a longer frequency. That will do the same thing. What Harpic does to your sanitary ware.
My God. So एक बात बताओ अब जैसे कि like be it Coke, Pepsi, these are huge multinationals, okay? So and people are consuming it in billions.
Yeah.
मतलब the number is huge. So even in moderation, is it that harmful? Like, can't you not consume these drinks at all, or is that what you're saying?
See, you can consume it. Now, if you're having it once a week or when you go to a party, okay, even if you say social drinking or occasional drinking is okay, okay,
Right.
but nothing should be in a high frequency or you shouldn't be addicted to it.
Right.
And also, there's a tip over here, those who are addicted to it, first of all, you should not be. Try to stop the frequency. After having any aerated drink, immediately rinse with normal water.
Ah,
So even for
okay.
that matter, even if you're having food, if you rinse with like you wash your hands, but there's you're having the chewing the food with your teeth, you should rinse your mouth also after having any food.
मैंने ये सुना है कि अगर आप सब चाय या कॉफी पीते हो, चाय कॉफी पीने के बाद तुरंत भी थोड़ा
Rinse कर लेना
रिंस कर
चाहिए.
लेना, क्यों ऐसा, क्यों इसको?
Because both of them have nicotine in it.
Ah,
Okay, to
okay.
some extent, caffeine, nicotine, both are there. Tannin. So these are all staining pigments, right?
Okay.
So when you're
Okay.
having them, there is a deposit of the pigment getting there
Hmm.
slowly, and over the months and years, the stains will come. So if you immediately rinse it, those things, the film which is still washable gets washed away.
Right.
Anything which can stain my coat here can stain your teeth.
Okay.
So even for that matter, turmeric
Right.
or red wine
Right.
can stain teeth.
So it's always advisable to then wash it with
Just
water.
just
Okay.
maintain a normal temperature after your teeth, your oral cavity comes in a normal temperature, and then you rinse with water. Simple tip. It's such a simple tip.
Okay. And are there any side effects to teeth whitening?
Teeth whitening is very subjective. Okay, now there are many people, many patients who come to us who have white teeth, but still they want whitening. So,
Okay.
first and foremost, it's our part to make the patient understand whether they need it or not. Because many patients come who have, I mean, beyond imagination expectations. So we can't give in to that. Just because you are there to do whitening, you're not supposed to do it. We have to counsel the patient whether you need it or not. And if any patient needs it, it's definitely advisable if done in the clinic under the supervision of a professional. There's no harm in that.
Right. And any tips from your side to whiten teeth naturally?
The best tip, at least get a basic cleaning done once a year,
Okay.
right? When I'm wearing a white shirt, you're wearing a white t-shirt,
Huh.
you will definitely wash it tomorrow.
Huh.
Okay, if you give it to the laundry, they'll wash it, they'll take special care of the white thing, and then you'll get it back. So why not with our whites? We never wash our whites. When was the last time somebody washed their whites? We brush it, but a professional cleaning is needed.
Right.
And if you do that, the color of the tooth will be maintained, and you won't see the need of whitening.
Right. Right.
That is the best tip.
So
And
most of the queries we get from people is like, doctor, I want whitening. The first question I ask them, have you got dental cleaning done? If yes, how long back? Once in a year is much recommended. Twice in a year is also okay. But don't look for teeth whitening. First, look for teeth cleaning.
So I'll like to add over here, there are two types of stains. There are the external stains and internal stains. First, get rid of the external stains and see what is the natural color of your teeth. If you're happy with that, then why do you want to go for whitening?
Right. Okay. And a lot of times, suppose we are at home, or someone who's maybe elderly at home, and they get that sudden sensation in their teeth, and and maybe it's 12 at night. बहुत दर्द हो रहा है. How to get rid of that, or maybe get immediate help for the time being before they can go to a dentist the next morning.
So first of all, such things are only happens if you have been neglecting your cavity or the sensation which was milder, but body is actually, it's magnificent, it's magical, it gives you alarms. If you are ignoring the alarms when they are, how the phone, when you put on snooze, again it will get louder and louder with each
Yeah.
time. So if you're neglecting in the first go, this is the, you are calling for it, the midnight scream, of your family or whatever. So if there is something like this, the first thing is call a dentist. And I'll not suggest to take a painkiller, which normally people do. It is kind of, you know, putting the tooth on a slumber.
Okay. Okay.
That, yeah, you are ignoring it. Maybe have it during that time. Clove oil can help you, but later visit a dentist next day.
Okay. Okay. Right. And we have often seen many times that अब कोई कोई लोग सोने के दांत लगा लेते हैं, कोई कोई चांदी का दांत लगा लेता है. तो अगेन, इज इट हेल्दी और इज इट जस्ट लाइक लोगों के शौक हैं तो अब लगा लिया?
So yeah, you're exactly right. There are many people used to have. I don't think there are maybe out of 100, 1% people still get gold caps done, gold fillings done. But let me tell you,
Grills.
gold is the best material to get a filling done.
Really?
It is the most biocompatible thing in your mouth. The
Wow.
only reason now is definitely you can still get, but it should be pure gold, and it will cost you like pure gold. And it is
So
really
how much does it
biocompatible.
cost? Suppose I ask you कि डॉक्टर प्लीज आप मेरे को एक सोने का दांत लगा
So
दो.
that will be determined about how much is your cavity or the size of your tooth. That will be the jeweler will tell you how much amount of gold is needed and he'll decide the cost. You will
So give
get
us
the
a
gold.
ballpark.
So it will definitely cost you something around about 45 to 50,000.
Also, here he has taken it in a curative, as a treatment way, the use of gold. I think you asked it for the cosmetic reasons.
Yes. Yes.
Yeah. For the cosmetic reason,
But somebody just has this fascination. Everything is
Fascination.
fine, but they want to extract the teeth and put a gold teeth
that is
or
again
gold tooth.
Gold grills, they are called.
so
Acha.
On the
many.
front, if you have seen some TV stars, it is in Western
Yes,
countries
yes,
more
yes. So is it good?
prevalent.
Is it healthy?
See, gold is, like I said, biocompatible. There's no toxicity in that. But getting a gold tooth is one's own preference. There are people piercing their tongue.
Correct.
There are people having their hair colored red, white. Young people getting it dyed white. So it is just your preference. There is no harm in that unless and until it is done without shaving off your natural tooth.
Okay, so there are no side effects to
No.
it, you're saying.
And in olden times, also people used to get, not extract, but they used to get gold caps fitted
Acha.
because that time when they used to go for trade, it was unsafe to carry cash.
Huh.
And they used to just place those gold caps, and when they used to trade, they used to give that gold as a value, as payment.
Have you ever received such inquiries that I want to get a gold
No,
tooth?
not unfortunately, no.
Okay. What is the weirdest request you've ever got from a patient?
Would like to answer?
Patients have come to us with pictures of film stars telling that I want this kind of a smile.
I want Hrithik Roshan smile.
Acha.
So that becomes very, you're in a very tight situation because I think, see, every smile is your signature and you should not change it. You should be happy with what you have. Yeah, definitely if there is some anomaly or something wrong, you can definitely get it modified, but you can't copy exactly what somebody else has.
Right.
Because it might not look good on you, right?
Yeah, correct. A lot of people go for these smile correction procedures. में क्या होता है? I don't know. Please correct me. They somewhat, I think they break कुछ दांत तोड़ देते हैं, बड़ा कर देते हैं, कर देते हैं. So how does it, isn't it painful? And again, are there no side effects to this? I would like to add one more thing. When generally somebody goes to a dermatologist, and वहाँ पे भी करते हैं तो side effects रहते हैं. किसी ने botox करा लिया, fillers करा लिया, या breast implants करा लिए. So there are so many side effects to it. Yet people get it done just so that they look in a certain way. So what about the dental side of things?
Joydeep, I would like to share a story here.
We love stories.
It's a real, I don't know, I should
We love real
be,
stories
yeah.
more.
The real experience, we were on the same page that we support natural, and like he said, do not cut your enamel or do not damage your body for something just for aesthetics. He got trained as a cosmetic dentist 12 13 years back. When he came, he was the first one to take up the courses, and when he came back, I used to dissuade patients after he used to convince them.
Okay.
So that's a con of a life partner and a business partner.
Yeah.
So because I always believed in natural, keep it very natural, and like I used to tell my patients that uh, God has gifted you with this. This is your signature smile. Why you want to change it? Things like that. And until I went for a course, he enrolled me for the course. Like, now, Harleen, you should go, and then only you'll realize what's the importance of this. The first question I asked my mentor was, I still remember that, why should we go for like smile makeovers? We do this to our patients when just for the beauty, just for aesthetic reasons. Then my mentor, Dr. Sandesh Maikar, he's a big name in Indian dentistry. He's a celebrity dentist. He said that if somebody is coming, a girl who is want to go for the pageant, beauty pageant, she wins a beauty pageant just because of the smile makeover. From like, she marries a rich man, you are changing her life from rags to riches. That journey of becoming a part of her success story just by changing her smile. And the same thing happened with us also. um, there was a patient, like a girl who came in that with the request that, doc, I have cleared 2 rounds of interviews of Indigo Airlines as a
Okay.
cabin crew.
Okay.
So for the third round, their trainer, she suggested her that please get her your smile corrected. Only this can stop you from getting clearing the third round. She came to us, and in like matter of 2-3 days, braces couldn't be done. Braces take at least 1 to 2 years. So that was our chance to change her life. And we did that. And now also, it's been like 10 years. We see her stories. We see her on Instagram. She's flying all over India. She's a cabin crew of domestic Indigo Airlines. And we're so happy to be a part of her story.
See, a smile makeover is not necessarily destroying your natural tooth and doing it.
Okay.
See, from the beginning, 2001 till date, 23 years, our principle has always been to save the natural teeth.
Okay.
And within that limitation, whatever we can do, we do.
Right.
When a patient comes, we always do a mock-up for them. A mock-up means when you go to buy a car, you do a test drive, right?
Yeah.
You want to feel. You don't want to pay 50, 60 lakhs just by, okay, this is a Ferrari, I want to buy it. You want to see what is different in that.
Correct.
So unless I tell you, Joydeep, I'll do this, I'll do that, and you'll have a very nice smile. But you won't understand the S of that smile.
I'll not
right?
be convinced. Yeah.
But when I tell you, sit down, I'll do a mock-up, I'll show you how you're going to look like. Then you will understand, yeah, this is the change which is. Yesterday only I did a case for the runner-up of, there's one show coming up in December, so she was a finalist. And she really needs alignment by braces, but it is in December. So she was almost, she just broke down because there's nothing can be done in 2 months, okay? So we gave her a mock-up of a very conservative treatment without even touching her tooth. Touching means without any damaging even a square inch of her natural tooth. And we did a mock-up and she was just bowled over. So what I want to say is that it's not breaking the teeth, and it is just using your expertise and reshaping the everything in such a way that you look better than what you are. It's not that you're looking bad, but if you are here, I'll get you till here. Maybe not till here by doing something destructive, but till here.
Okay.
But definitely not there.
Right.
Right?
Right.
So over here, I would like to ask you one question, because why I'm of this belief is cutting a tooth is the biggest crime according to me. Okay, you just answer, if you may, just answer yes or no. When you cut your nail, does it grow back?
Yes.
When you cut your hair, does it grow back?
Yes.
When you get a cut or a burn, your skin grows back.
Yes.
If someone donates a liver to his dear one, his liver
It
grows
grow.
back.
Yes. Yes.
When you drink eroded drinks, or when I cut your enamel, will it grow back?
I know it won't.
There is nothing. I mean, there's only one thing in the body which will not grow back, is your enamel. And how do you just go sit in the front and let anybody cut your enamel? Just think about it. If you think, you'll understand the
But
importance
then
of
why
it.
do people still go ahead and allow people to cut their enamel? Why?
Because people are least concerned about their teeth. The education is a must. And that is why I'm here in front of you to make this point forward and let everybody know. That is a main reason for doing a podcast like this.
And what are the expenses of doing a smile correction treatment for the viewers who are watching it? Give us an estimate
See,
from the lower end and
I'll
to
tell
the
you.
higher end.
I'll tell you. Whenever a patient comes to us, we always consider that patient to be one of myself. And if my brother, sister, or anyone is sitting on that chair, I'll give them, or we give them 2 to 3 options from the minimum to the maximum. But there will always be a range, because I can't go below a minimum. I can't drop that standard. When I'm using something, when I'm drinking water in this, you won't serve me tap water, right? You will give me either from AquaCare, or you'll buy a Kinley and give it to me,
Right.
right? Or from a normal filter. So I also give those 3 options. I can't go to a tap water budget. So my budget is always from a minimum to a maximum,
Right.
which will serve, which that thing will be in your mouth and should be there and not be of any harmful effect.
Right. And what is the minimum to the maximum?
It's very I mean, it's very vast. I can't give a single code, you know. But now suppose, for example, if I take a gap between your teeth, it can cost you anything from 7,000 to 20,000.
Okay. Okay.
And
Right.
all will be good. Definitely the longevity will be different,
Right.
but all of them will look good, will be of good material, and will serve your purpose.
Right.
So how's the pricing decided? Like he's giving his range, but
Yeah.
the industry range is also similar.
Okay.
Pricing depends on the expertise of the dentist, the education, and material is almost the same actually.
Like I said, I may close that gap without touching the tooth.
It depends on the expertise,
So
basically.
you
So we
that
need to choose a dentist really well.
Yes. So it's not about the material only. It's not about what I say, my patients. See, whatever I'll charge you will be anytime cheaper than the value of your smile.
Right. What is the difference between a dentist and an orthodontist?
So orthodontists are dentists who specialize in teeth alignment.
Okay. Okay.
So like he said, dentistry has multiple multidisciplinary, like crown specialist, denture specialist, braces specialist. So orthodontists are basically braces specialists, you can call it.
Right.
Teeth alignment.
And how do you manage bad breath without going to a dentist? Home remedies.
Home remedies, not like very simple is brushing twice daily. But how
Okay.
many of you do that? How many of us, even dentists, I would say, like, what is the population who follows? What is the percentage of population who brushes twice daily religiously? Not like 3 days in a week, like you go to gym.
So even over here, again, I would like to clarify, bad breath is not only because of teeth.
Correct. Yes.
There are many
Yes.
reasons, okay?
Yes.
Bad breath can be if you're not drinking enough water,
Yes.
your mouth is dry. Have you ever, you must have smelled your breath when you get up in the
Yes.
morning?
Yes.
It's foul.
Yes.
Because the whole night your mouth was dry. And there are bacteria which have sulfur, which causes this bad odor. Secondly, not eating food on time. Thirdly, if you are diabetic or you're a smoker. Fourth reason might be if you're not having your digestion problems. Fifth will come to the teeth and the gums health. So it's not only the fifth reason, there are other fours to be corrected also.
Right. Give us 3 ways to maintain a good oral hygiene. And 3. Fourth मेरे को पता है क्या है. Go to a dentist. So वो मत बोलो आप.
You take a-
फोर्थ वाला ही लोग नहीं फॉलो करते हैं.
नहीं करते हैं. Correct.
Brushing and flossing, as ever. Eat healthy. Eat, chew food. Don't be on a rush and just,
Gulp it down.
gulp it down or be on refined food all the time. Like raw vegetables, salads, have that.
Mm.
Like chewing is an exercise for teeth
Yeah, yeah.
and it also cleansing.
Uh,
So the more rough edge, more fibrous food you have, it will cleanse your teeth. Have
hmm.
you tried it out? Winters are coming. Try eating the palak ka saag and
Mm.
then feel your teeth. You'll
Ah.
feel very smooth because it is a natural cleanser.
Mm.
So the more fibrous food, more rough edge, your teeth will get clean. Apart from brushing, flossing is a must, especially at night, because brushing just cleans upar upar se, but the food gets stuck in between the teeth, and that has to be cleaned. And that is where the cavities happen. So flossing is important. And
What is flossing
yeah,
exactly?
so many times you must have noticed when you have something fibrous, it gets stuck between your teeth,
Yeah,
and
yeah.
you just by default pick up a toothpick and poke it and take it out.
Yes.
The moment you do that, a toothpick is definitely wider than the gap in between your teeth. So every time you're doing that, you're just pushing your teeth apart and widening the gap,
Mm.
right? So there's a better way, a medical way to clean it is a floss. It's a very fine wax thread which is to be passed through the teeth, which will go through the teeth and come off, remove everything without widening the gap. So flossing is very important
Mm.
apart from brushing. And those who
Like a bag.
have wider gaps, you
Mm.
have other things to clean. There
Mm.
is even a water flosser available. It's a jet of water spray which
Yes.
cleans everything between your teeth.
So, what is the price of these two items generally in the market? What is the price point?
See, that varies. Okay, floss will cost you anything from 100 rupees. A flosser will cost you from a basic price of 2,500 rupees.
Right.
It,
Okay, so
yeah,
that's
that's a floss. This is a prefabricated floss. You also get a
okay.
floss like a spool of thread, which you take it out and you can just pass it and throw it.
So, how long should this entire exercise be? It seems as if अभी ये जिम की तरह हो जा रहा है. बहुत मेहनत लग रहा है.
2 minutes.
नहीं, ब्रश कितना करना चाहिए?
Two,
एंड
कितना मतलब कि just 2 minutes is enough.
एंड उसके बाद फ्लॉसिंग कितने देर के लिए करना चाहिए?
Flossing
ऑल
is
सब करना है ये.
wherever you have space in between the teeth, you should floss. Mostly you should floss between all your teeth, and trust me, it doesn't take even a minute. It's all
ओके.
depends upon your.
बिकॉज
Initially, it
ये
may
मैं
take,
नहीं
but
करता हूँ
then
बट मैं कल से यही करने वाला हूँ बिकॉज आई
Yeah.
रियली वांट टू टेक दिस अप.
not people
Because
know. Many people know about this.
Exactly.
Not
Because I think a lot of time people confuse flossing with cleaning their tongue. I think ये
No.
No,
it's
different.
completely
It's
different, no?
different. And nobody has told you to stand in front of the mirror and floss. You while flossing, you see your television, you see your podcast, whatever you want to see, you see,
Right,
right?
right,
It's not killing. It's not making you fixed at one place and not
right,
letting you do anything else.
right. And how important is cleaning the tongue?
That's also important, actually. Sometimes you have coated tongue.
Uh,
People who have,
Clean it gently with the toothbrush at the back side of the brush. These days you get it,
yeah,
silicone cleaner.
yeah.
Don't take a metal and scrape your tongue. Okay, don't be harsh to your
That
body.
is like even 10,
see,
15 years पहले भी लोग वही
ठीक है,
करते
you
थे.
can pardon them 10-15 years back, but
Yeah.
आजकल के ज़माने
आजकल
में
तो ये नहीं करना चाहिए, राइट. एंड मैंने सुना है कि जो हम टूथब्रश यूज करते हैं वो भी कहीं ना कहीं हार्मफुल या पॉइजनस होता है. क्या वो सही है?
no, not at all.
it's not. How can a toothbrush? I mean, I don't think so. I've not heard like that. Yeah,
Right.
it should be a good product,
Hmm.
definitely, not a roadside 5-2 रुपए का brush, you know.
Hmm.
So a proper toothbrush, if you use it diligently, not. I don't tell to brush hard also.
Right,
You
right.
should use minimum pressure.
Okay.
And your toothbrush should be changed. If you
Hmm.
don't change it after 2.5 to 3 months, it will cause
Okay, you should change it
destruction.
after every 3 months, that means.
Every
It
three
should.
months, and if you're using too much of pressure, maybe after 3 days, once you see the flare,
It's coming. Yeah,
it's
yeah, yeah.
becoming like a flower.
Yeah.
The bristles are flared
Yeah.
enough. So, first of all, change the toothbrush, and also do not put that much of pressure. Maybe switch on to a motor brush because it has a pressure control system.
Right.
You don't have to use pressure in motor brush.
Right. So, fluoride. Now, fluoride is available in all the toothpaste that we get in the Indian market unless you're using, say, a Himalaya or a Dabur. And I had read somewhere that fluoride is banned in the US in their toothpaste, but it's not banned in India in our toothpaste. Now, why is this?
fluoride is not banned completely in US. It is there in toothpaste in measured quantities. Like if you buy a Colgate or a Pepsodent, for adults there's a particular level of 1000 ppm. For children, there's a particular toothpaste with half, almost maybe 500 ppm. It's not banned. It's banned if you are buying it over the counter and using it just without any supervision.
Okay.
And we generally, in US, it's a practice. Now, if in our clinic also we do for kids, once your entire treatment is done, we give them fluoride application in measured doses, which is advisable fluoride application. It's a topical application to prevent further, it reinforces the teeth and the chances of cavity becomes less.
Right.
Because there's a vaccine for every disease. There's a vaccine for corona, for measles, mumps, etc. But there's no vaccine for dental caries. Even that is scary. I mean, sometimes I think and I consider myself to be very lucky that I'm a dentist because there are so many things which are not there to cure your teeth. There's no vaccine, your enamel doesn't regrow. So,
Yeah.
I mean, so there's a way by doing fluoride, you can at least prevent the decay.
Right.
And also, certain places there is enough fluoride in the water. In those places specifically, you need to use non-fluoridated toothpaste.
Right.
So, yeah.
So there are no any again there are no harmful effects of fluoride as such.
If in excess,
Okay.
yes, it does happen.
Okay. Okay.
So
Right.
that's the reason you should use non-fluoridated toothpaste if you already consuming fluoride through the normal water.
Right. What? Give me two pros and two cons of working together as a partner. As a partner and as a partner.
As a business partner and as a life partner.
Yes.
So,
अच्छा आप एक बताओ एक प्रो एक
हाँ,
कौन
एक-
आप एक प्रो एक कौन बताओगे हाँ
See, pro is that you can always discuss any downside which is happening with you, or maybe when you're, facing some difficulty in a case or some situation in the clinic, you can always have someone to discuss who will understand at least. And if he or she is not a dentist, they will listen, but they'll not be able to give you
Understand,
a
yeah,
solution or
yeah,
something like that.
yeah.
And that is one pro. The other pro is, whenever you are bored by continuous treating the whole day and you need a break, you can at least, you have someone beside you and
Yeah.
chalo yaar, ek thoda कुछ खा पी के आते हैं, है ना?
एक और प्रो हो सकता है ना, like dentist always should marry a dentist because खुद की treatment तो नहीं कर सकते. You need other person to trust with your teeth.
And con
See, as for cons, till date, luckily I don't have any.
अरे क्या बात
Truly.
है lovely
So, con can be for people who think that they are in a wrong profession. It can be there is no, what you say, like difference between professional life and personal life.
yeah
There's no boundary. We don't have, because dentistry is our passion, and we bring our profession home
right
with each other.
right and कभी ऐसा कोई पैसों को लेके अनबन हुआ है मुझे ज्यादा पैसे चाहिए तुम नहीं लोगे ऐसे कभी कभी भी ऐसा हुआ है
See, हमने कभी पैसे के लिए काम किया नहीं है.
अच्छा
We are always, our intention has never been, earning money and then deciding what case has to be done. We have always decided what you need. And what you need to give you the best, so that I will decide. This is the best for you. You should get this done. And we never discuss inside the clinic when we are treating a patient or checking a patient that this is the cost. That is always discussed by the office, the reception.
okay
Because if you need this, we are clear you need this. I am there to decide what is best for you. But if you give me the option, no, ye mat kijiye, ye kar dijiye, then it becomes a little difficult because the outcome which I want for you will not be there. And then at the end, I'll be only blamed.
so the fact that you're saying you've never worked for money is it down to the religious teachings that is there in your particular religion or is it something else
There's nothing religious, but it is maybe the upbringing, I mean, because it's my parents, my elders, my mentors, whomever I have been in contact with, all of them have done good work. At the end of the day, they just wanted to do the best for a patient. When you do the best for a patient, rest will come.
right and otherwise like do you both individually belong to very religious families who believes in the divine
Yes,
or
of course. Yeah, both
Yeah,
of our parents
definitely.
are piously.
एक कोई ऐसा गुरु नानक देव जी का एक कोई आप टीचिंग बताओ जो आपने डेली लाइफ में फॉलो करते हो आप भी बोलना
See, one of the teaching is definitely कि आप दूसरों के लिए जितना कर सकते हो करो, और आप जो भी अर्न करते हो उसमें से कुछ हिस्सा आपको कम्युनिटी के लिए देना है.
जी.
इसीलिए we always have, mostly on Saturday, we have two centers. One is in Rajarhat and one is in Elgin Road. On Saturday, we have a camp there in the other clinic in Rajarhat, and Sundays we have a camp in our clinic in which we have free checkups. And we also give the best treatment at a very minimal cost of only the material costs. So that whatever we are earning, we give back to the society.
Right.
So in Punjabi it says kirat karo one chako. Kirat karo matlab do your duties, and one chako means बांट के खाओ.
अच्छा.
बांट के खाओ, वन
Okay.
छको.
Right.
पहले बांटो और फिर खाओ.
Right. I'm sure you both have been to the Golden Temple. गए
Yeah.
होगे
Of
आप लोग.
course, yeah.
तो मैं भी गया हूँ. तो आई थिंक जब हम गोल्डन टेम्पल में घुसते हैं, और मैं मेन टेम्पल की बात नहीं कर रहा हूँ, मैं वो जो सराउंडिंग जो स्क्वायर
परिक्रमा
सा
है.
जगह है उसको क्या कहते हैं?
परिक्रमा.
हाँ, तो वो परिक्रमा में आप जब रहते हो ना, उसी वक्त द मोमेंट यू स्टेप इनसाइड द मेन गेट एंड यू इनसाइड दैट परिक्रमा, बीच में देयर इज द पॉन्ड, द वाटर बॉडी, तो you feel that there's a sense of some supernatural power which is there, which is making you feel very emotional, happy. It lets go of all the problems that is there in your life, at least for those 5, 10, 20, 30 minutes that you're there, which perhaps I've not felt in other religious places. Again, no disrespect, no disregard, but just a personal feeling.
Yeah.
Do you all agree, and do you have any such moments to share about the Golden Temple?
Yeah, see, I definitely agree with that.
And it is the world's, I think, largest free kitchen, right?
Yes,
If I am
it's
not
a free
wrong.
kitchen, right?
Yes.
Because the kitchen is running 24 hours, and so see, this is again all called Seva Bhav, because everybody over there, there's no paid staff over there. Everybody, each and everyone, from a child to an elderly person, is doing Seva voluntarily. There, nobody is forced. You see those who are collecting your shoes, or in the shoe house, they are all with their will. So nobody is forced to do anything. And when you are not forced to do anything and you do it according with your will, everything happens nicely, organized, and in a peaceful way. Okay. The same, and in connect to this, we have always done the same thing in our clinic. In our clinic, I don't want to, it's not, I'm not bragging, but this is the feedback which we have constantly got from our patients. Whenever a patient, a patient coming to a dental clinic definitely is in pain, irritated.
Obviously, yeah.
Because of the pain and also everything going around him in his or her life. But whenever they come, and whenever I do the checkup, they come inside and say कि डॉक्टर साहब एक बात मैं बोलना चाहता हूँ या चाहती हूँ कि यहाँ आके मेरे मन में बहुत शांति मिलती है. And trust me, from 2001 to 2024, these 23 years, this is the feedback I get till date. And I'm blessed. It's just because of the Almighty that this is happening. We try to. It's not that we are doing something intentionally, but its intention is
It
so
comes from
strong
within,
that
basically.
it comes
Yeah.
because
Yeah.
we try to do that and try to instill in our staff everything the same, and that is how it comes.
Right.
And I firmly believe, that I always tell her, just in a joking way, but I mean it is कि मेरे लाइफ में एक ही चीज चलती है, अल्लाह मेहरबान तो गधा पहलवान. When he is there, everything is happening.
Right. And talk to us about some of the celebrity patients that you have or you may have treated.
Starting from Tollywood celebrity or Bollywood celebrity?
Anything, anybody. आप बॉलीवुड भी बोलो, टॉलीवुड भी बोलो, क्रिकेटर्स,
We
पॉलिटिशियंस, कुछ
can't
भी हो.
take a few names, but
जो नहीं ले सकते उसको छोड़ दो, बट जो आप ले सकते हो वो आप बोलो.
So we have a patient. Recently, she is the third runner-up in the Miss Universe, Sushmita Roy. You must have heard.
Yeah.
So she is our old patient, So she keeps coming for maintenance. She's very well aware of dental health, so she keeps regular cleaning done, and that's credible for. So one day I was just in my operatory and I got a call, that Dr. Saab, it's an emergency and you need to come because Miss Sushmita needs you urgently. There's some emergency over here. So I said, because she had just visited 2 days back. I told him that, but we just saw her 2 days back. What is the emergency as such? He said, no. she was not here. She just landed in Kolkata today. So I said, which Sushmita? He said, it's Sushmita Sen. You know Sushmita Sen. So I thought it's a prank call. I cut it off. And I got a call back again, and I said, I mean, the Sushmita Sen, and he said, yes, she needs an emergency call. So, and then that was when I got the chance to, attend to her.
And how was she as a person?
Very good. She
What was your
no
experience?
air about anything about her status which she is in. She was very down to earth and very cooperative and very sober, very sober.
Any other celebrity experiences?
Koel Malik. She is also a gem of a person. I don't know why people have those airs about celebrities. When you say, one thing we also thought, when people are coming to our clinic, we should not know that we are not into Bollywood movies, and also we should at least not know that they are celebrities. It gives you a jitter sometimes that, okay, you're treating a celebrity.
Yes, yes.
For that moment, we are treating the tooth, and for us at Dontia, everybody is a celebrity. That should be our motive. So coming to Koel Malik, yeah, she's one of our patients, a whole family, Nishpal Singh and Surinder Singh, who has a production company.
So again, the whole family, I mean, if you don't know them, you will never know that they are of such a high state. She's such a big actress, She has never thrown tantrums, never. Whenever we call her, she comes exactly on time and follows everything.
Right.
Koinaka is also one of our
Yeah,
patients.
there are many.
Right. And is it easier to treat celebrity patients or is it easier to see non-celebrity patients?
Well, till date, those celebrities which have come have not created any fuss. So till now, all of them have been equally cooperative. So we have not felt that till now, luckily.
Right. And what is the most memorable case you have worked on till date?
One story I've already shared about the girl who is in cabin crew of Indigo. The second one, memorable or very touching, you may say, a lady who had come to us with her 45 year old, and with her front teeth broken, both upper and lower, which is quite unusual at that age. For a simple housewife to, come and with missing teeth, front teeth, all her front, upper, and lower. So, during the treatment, we asked her for a medical history and everything, the family history, she just broke down and she said that this happened because she faced domestic violence. I'm getting goosebumps that and now, because she is parted away from her husband and her daughter is in a well placed job, she is sponsoring her treatment of her mother's dental treatment, and she's getting her new teeth. So we see such kind of, I should not be saying stories, real life incidents are we are able to be a part of their life, which is actually for which we became doctors and came into this profession. That is actually rewarding.
So like in our clinic, we are not day to day only doing dentistry. Dentistry might be, definitely we are doing it, but along with it, every patient has their own story to share. And, there are many things to share and we listen to them. We try to, understand them and they feel much better. 80% of their pain goes away like that.
Right.
So empathy is a very crucial thing to have as a healer, because we are healers, right?
Absolutely, yes.
Become like a family member to us, because they open up, they really open up in front of us.
And what would you want to say to the next generation of dentists that are coming, who are maybe right now in schools or in colleges, or they're maybe dreaming to be a doctor? What is your advice to them?
Actually, there is a lot of, maybe you can say questions from the family or friends or society. There's so many dentists. Why are you becoming dentist? Maybe you can say competition, but I would say that it's there's just one heart, two kidneys, and but there are so many doctors there. And when you talk of dentist, Where is the competition? There are 32 teeth. There's no lack of patience. There's no lack of work for us. So when they feel, maybe threatened or yeah, the industry is saturated, it's not this lack of awareness. That's the challenge.
Right.
Till date, there is still a deficit of dentists because, see, a gynac will have only female patients. A geriatric will have old patients. A pediatric will have only the small patients. But we will have all those patients who have teeth or whether they don't have teeth. Right. So that is the thing.
So, what is the difference between, say, the US, the European, and the Indian dentistry? Maybe one point of difference.
See, for the dentists outside India, half the obstacle is one because they are all well aware, well educated about the importance of teeth.
Right.
Right?
Right.
That is the major thing which we are lagging behind.
Mm.
And that is why they get the regular checkups, regular treatments done. They don't wait for a disaster to happen. That is the main criteria, I think.
Right. And
Actually, neglect, I would say. Because of the lack of awareness, there is neglect, and the blame comes that dentistry is expensive. It is not.
Rather, neglect is expensive.
Right. And who gets paid more, the Indian dentists or the dentists who are outside India?
So, you, from what I said, if they are more aware, definitely there will be more visits to the dentist by those patients.
Right.
Now, suppose, God forbid, today you have a very nice biryani meal at night, and midnight you have a pain in the chest. Okay, you will definitely run to the emergency or call up your doctor, and he will say, get the test done. You will get all the tests done, whatever he prescribes, maybe a bill of 20, 30, 50, whatever, but you will do it, right? And what happens if you just have a sensation in the tooth? You will maybe apply some desensitivity paste to take a Calpol and go to sleep and then forget it if it will not come back. That is the difference why a dentist is earning more over there and less over here.
You forget it, it will not come back, and you will say, everything is fine. I took my Calpol, and since then I have not got any pain. And one day your tooth will break,
Right.
and you'll be fine. I'll
Whereas,
eat from the other side.
and whereas
That
the
happens.
chest pain which you had after all the tests, वो बोलते हैं ना खोदा पहाड़ निकली चुहिया, it was just a gas.
Yes. So, in 2024, would you recommend braces to somebody who wants to fix their teeth? Or would you recommend something which is more modern, such as Invisalign or something of that sort?
Of course, with advancement in dentistry, you update your phone. When you have to take a new phone, you want a better version. Why go to braces if you have Invisalign today? They are barely visible. No restriction in eating, no age restriction. So definitely, Invisalign is a company, but actually the name of the product is aligners.
Okay, great. A lot of dentists are getting into dermatology, which a lot of dermatologists are not liking it. So, why is this happening?
I don't know about others. For us, actually, our patient asked for it. After we did the smile correction, so patients were like, so doc, why don't you give the skin consultation also? And we got a dermatologist on board, and now we are entering into skincare
Right.
services.
Okay. So we'll jump to the last section of this podcast, which is the straight or twisted section, and who will be taking the questions?
He's doing good.
Great. Okay. So I have about 7-8 lines जो मैं जल्दी जल्दी बोलूँगा. आपको सिर्फ either straight बोलना है या twisted बोलना है, अभी जल्दी जल्दी बोलना है. So are you ready?
Yeah.
Okay. Oral health affects overall well-being.
Truth.
Brushing immediately after meals is best.
Truth.
Wisdom teeth always needs removal.
Truth.
Humans with sharp canine are vampires.
Twisted.
Dentists like their partner based on their teeth.
Twisted.
Female dentists are very beautiful.
Truth.
Every RCT needs a crown.
Twisted.
Dentists giving guarantees, warranties are real.
Twisted.
Dentists can treat headaches, migraines, and all other mild issues.
Big truth.
Thank you so much, doctors. Thank you so much. It was a pleasure having both of you at Twisted Truths. And on behalf of the entire team and myself, we wish Dontia Dental Care and you two all the very, very best.
Thank you, Jolly. It
Thanks a
was a
lot.
pleasure being here.
Thank you.